Hello guys, today we'll talk about tetanus vaccine. So what are the types of wound we have? We have clean, minor wound, and all other wounds. If the patient has not immunized or less than 3 doses, so at clean minor wound, yes, he will take a tetanus vaccine. But no for tetanus immunoglobulin. And for all other wounds, yes, he will take tetanus vaccine. And yes, for tetanus immunoglobulin. If the patient has taken 3 doses or more, less than 5 years since last dose, so it will be no for clean and minor wound at tetanus vaccine, and no for tetanus immunoglobulin. Regarding to all other wounds, it will be no tetanus vaccine and no for tetanus immunoglobulin. If the 3 doses or more, it will be from 5 to 10 years since last dose, it will be no for tetanus vaccine regarding to clean and minor wound, and no for tetanus immunoglobulin. If the patient has all other wounds, it will be yes for tetanus vaccine and no for tetanus immunoglobulin. If he immunized at more than 10 years since last dose, it will be yes for tetanus vaccine if he has clean or minor wound, and no for tetanus immunoglobulin. And regarding to all other ones, it will be yes for tetanus vaccine and yes for tetanus immunoglobulin. So thank you so much for watching my video, and please don't forget to subscribe, like, and share the video. See you soon. Bye.